This is Average Joe PT, and on last episode we talked about spinal decompression, or also known as traction. So I'm going to leave a link up there and hope you'll watch it after you watch this. This episode specifically, we're going to talk about the SI joint, the sacroiliac joint. What's the hype about it? What are the do's and don'ts that you shouldn't be doing that you see on the internet? Is it really the pain coming from somewhere else and it's not the SI joint? And we're going to go over some exercises that you can do if truly you have an SI joint problem. So stay tuned. Now, when we're talking about the SI joint, people really try and make it more complicated than it needs to be. Let's first go over what is the SI joint. Really quickly, the SI joint is the sacrum, this little orange bone here, and the ilium. So that's the SI joint. So those two bones make up that joint, and essentially, as you bend forwards and bend backwards in your lower part of your back, that moves. So as your back moves forwards, that joint moves the opposite direction. So it kind of moves like this. Doesn't move a whole heck of a lot, but does move enough. If you got inflammation or any type of pain in that area, you're going to know it immediately. So that's the SI joint. And what we're going to do now is really talk about the diagnostic pieces of it, what you can do at home versus what they're going to do in the clinic. Now, in the clinic, they're literally going to do several things. They're going to do injections in that lower part of the SI joint to see if your pain's resolved. So they're going to do it as a treatment as well as a diagnostic tool. They might go ahead and just do some imaging to that area to make sure that there's nothing going on in regards to maybe like a rheumatoid arthritis or an infection. So they might do some lab work on you to make sure it's not coming from one of those. And once they've cleared that out, they're going to send you to a doctor of osteopath, or they're going to send you to a physical therapist. And the physical therapist should do these 5 specific tests on you, and 3 of the 5 have to be positive, which means is they have to elicit the pain that you're having to rule out a lower back issue from the SI joint. Because when you're having pain in this area, it's very, very difficult to delineate the difference between a low back problem and an SI joint problem unless you're having neuropathic pain symptoms. If you're having shooting pain down the leg, numbness and tingling, it's a lower back issue. It's not an SI joint. You might have some SI joint pain because it's getting referred from up above, but it's not an SI joint problem. So these 5 tests are just like this. I'm going to show you on this little guy here. So he's going to come right in here. The first test they're going to do is you're lying on your back and they're going to squeeze your hips together, and then they're going to go ahead and pull them apart. And if you're having pain on that back side of that SI joint area, they say, okay, that one test is positive. If you don't, it doesn't hurt there. Hurts where you're pushing. That's not a positive test. The next test is they're going to lie you on your side, and they're going to push down on that pelvis. If they have that pain on either that side because they're pushing into that, that's a positive sign. If they go ahead and have you lie on your stomach and they're just pushing down on that sacrum, the spring test, and that gives you that SI joint pain and not lower back, that's a positive sign. Now we move to the front. If they take one leg, we're going to drop it right off the table, and we're going to take the other leg and bring it towards your chest, and they're going to kind of do like a quick thrust in the opposite directions. If that gives you that pain, then it's positive. And then the final test they're going to do is they're going to take one leg and bring it up towards your chest. And what they're going to do is they're going to take and cradle underneath while you're lying on your back. And they're going to pull on that SI joint area and push down on your leg at the exact same time to see if that elicits the pain. So those are the specific tests they should be doing, and 3 of the 5 have to be positive to give you an SI joint diagnosis. And that's the most research-based, significant test that actually tell well whether it's an SI joint problem or a low back issue. So that's the diagnostic stuff. Now let's go ahead, and the first thing you want to do treatment-wise is what I always say. First 3 days, you want to ice, you want to rest it, you want to do those anti-inflammatories. Give your body 72 hours to see if it can resolve the problems all by itself without having to go into this other stuff, because there's a lot of stretches on the internet, and if you don't do them correctly and you're in that initial inflammatory phase, all you're going to do is bother it more. And you're like, well, the exercises aren't working. Well, the reality is you have to get past that inflammatory phase for your body to even start to recover correctly and being able to do the exercises without pain. Now, there are a couple techniques. They're called MET. That stands for muscle energy technique. Now, I'm going to show you one of them. It's called the shotgun method, and it's the simplest one out there. Now, there is one more I might show you as a caveat towards the end, but it's a little bit more complicated if you truly are having an SI joint problem. If you like this video, go ahead and give me a thumbs up so we can get this out to other people. I want to help others and hopefully get them to do the right things and see all the stuff on the internet and hopefully not do the wrong things that they see on the internet. So hopefully you'll share this out to other people that we can go ahead and help them. So let's start out with the first stretch. So I'm just going to show you here, lying down here. All I'm doing is I'm crossing my leg over. I'm doing the basic piriformis because that piriformis muscle attaches at the sacrum and comes over. And if that is at all giving you a problem with that SI joint, it will typically be tight and painful. So I'm showing exactly how you don't want to twist your spine at all. You're just pulling your knee towards the opposite shoulder, holding for maybe 15 to 30 seconds and then relaxing and then rinse and repeat and do the other side. The next one you want to do is just the basic lunge stretch. Now, this is done wrong. I'm going to show you the correct way. First of all, you don't want to overextend your back because that can bother you. And you don't want to bend forwards because then you're getting the movement from your back and you're not really stretching out your iliopsoas muscle because that's exactly what you're doing here. Now, give me a DM down below if you want to ask any questions about those two muscles. Hopefully, I can give you some good education in regards to those. And so that's the basic stretching. You have the major iliopsoas in the front that it's got attachments to the hip and the spine, as well as the pelvis area, and you have the piriformis that attaches directly to the sacrum and comes over to the femoral area. So once you're done with those two stretches, I'm going to go show you the shotgun method. All you're going to do is lie in a hook line position with your knees bent up, feet flat on the floor. You're going to take your hands and you're going to put them against the knees. You're going to push against the knees, resisting that legs going out, and then immediately go ahead and put your fists in between your knees and try and squeeze your knee. And you're going to get probably a pop in the pubic area and maybe in the SI joint area, and that's just a self-mobilization. So that's called cavitation, that popping sensation where basically it's going from a fluid to a gas form. And then the last one I'm going to show you here is the caveat one, where you're bringing one knee up and you're giving resistance while the other leg is fully extended out and you're pushing the back of your heel down into the floor. So you're engaging the iliopsoas when you're bringing the knee towards your chest, and you're engaging your hamstrings, which are attached to your pelvis on the other side, to try and pull your pelvis in the opposite direction. So those are the two main mobilizations and muscle energy techniques that you can do in the home. So like I said, if you guys have any questions about this episode, go ahead and leave me a direct message down below. Hopefully I can help you out. And hopefully I'm going to leave a link up here with another episode here, and hopefully you'll link onto that after you've seen that one. So until next time, Scully and I always like to say, look up and keep smiling. See you next time, folks.